The Safe Berks Healthcare Advisory Committee is a committee consisting of community members and healthcare providers, nurses, etc., to come together and provide the best care we can for persons who may be victims of domestic violence, human trafficking, and intimate partner violence.
We had talked for years about how it would be useful for the hospital to have someone in the emergency room, actually in the emergency department, embedded there on site. We decided that we would partner with Safe Berks on getting a grant so we could have a trained advocate on site in the emergency department. As a result, then Tim Marks was involved.
Tim's background is he's a nurse, and he's a nurse executive. He was the senior administrator, senior director for emergency services at Reading Hospital, and he was really able to know that there was a need that was being unmet.
So the healthcare committee, we decided how can we bring the expert to the patients and where are the patients congregate. Mary Kay applied for the grant, and my colleagues from St. Joe's and from Berks Community Health Center also co-signed this grant, which Mary Kay brought to the state, which allowed us to get grant funding.
The Medical Advocacy Partnership Program has a medical advocate sit at 3 different organizations: Reading Hospital, St. Joseph's Hospital, and one of our community health centers.
The 3 medical advocates are placed in where patients are. So they're not a service that's added on. They're not an additional thing. They're working in the buildings.
The advocate is there to screen all women or men that come in with suspected injuries related to some type of physical or emotional abuse, violence.
We're able to make referrals to her so that she can see patients who may be in a domestic violence situation. She also has provided education to our staff and providers so they're more aware of the program and the different programs that Safe Berks offers to help those patients.
So without me being there, a lot of times the victims are coming through the hospital and they're being treated medically, and we're missing the whole social part. With me being on site and me meeting with those victims and showing them the options that they have, whether it's Safe Berks or whether it's community resources, that's giving them another option. Tim was instrumental on advocating for me to be there, letting the hospital know that I need to be there, somebody needs to be there for these victims, and Tim really pushed to get me on site.
So now we have an advocate, and we've been able to see an increase in the victims that are willing to ask for help.
It was very, very clear that Tim is very passionate about people who've been involved with domestic violence and getting them help and their families help.
So I think Tim has a passion for helping people, and that comes out, and this is one way that he's partnered with the community.
Tim is very passionate. It's very nice to have a male in the role that is passionate about this type of work and women's rights and women's health.
My passion was driven out of my 20 years working in emergency departments, and we were always very good at taking care of emergencies, fixing up people medically, making sure that they were okay physically, and we had some opportunity on the other end, keeping patients safe once they left the hospital, and also making sure that we took care of them as a person.
Tim is dedicated, really able to mobilize a group to work toward a goal or a mission.
You know, he's not a kind of a person that's a bully and goes out and makes you do stuff, but he makes you do stuff. He makes you want to do stuff by being just there.
Thank you, Tim, for your dedication and compassion. I think your efforts to bring this need to light has helped us accomplish what we've been talking about for years. Thank you so much.
Congratulations, Tim. We do so appreciate the groundwork that you've set for us.
Congratulations, Tim.
Congratulations, Tim. Great job.
Receiving this honor from Safe Berks is really, there's nothing more I can say than it is an honor. What I was doing is bridging the gap between two very good organizations and saying, how can we use our community partners to better the care that we deliver? And that's something that's a passion of mine, and I was honored to be able to do that, and then I'm humbled by the ability to be honored for that.